They thought everything was fine. The dog knew it wasn't. He had known for 6 weeks before anyone else in that house was willing to say it out loud. It started with a laugh. Nadia Weston's daughter, Rosie, was 9 weeks old. She had not yet produced what the development books call a social smile. The real one. The one that comes from recognition rather than gas. Nadia had been watching for it, the way all new parents watch, leaning over the crib, pulling faces, waiting. The waiting had a weight to it. Everything had a weight to it. In those weeks, Nadia was aware that this wait had a name, that there were numbers to call and questionnaires to complete, but she had not acted on any of that awareness. She had told herself she was managing. Their golden retriever Clement had been present for all of it. He was 6 years old, the kind of dog that fits into whatever emotional temperature a house is running at. Quiet when things were quiet, warm when warmth was needed. He had accepted Rosie's arrival with the same gentle competence he brought to everything. He had not pushed for attention. He had simply been available. On a Tuesday morning, Nadia was sitting with Rosie in the low chair by the window. She wasn't doing anything specific, not reading, not on her phone, just sitting with the baby in the way of someone who has run out of bandwidth for anything that requires more than sitting. Clement came from the kitchen. He walked to the chair. He lowered his head to Rosie's eye level and did something Nadia had not seen him do before. He exhaled, slowly, a warm breath, directly at Rosie's face, and then tilted his head. He tilted it the way dogs tilt their heads, that precise auditory calibration, the ear rotating, the eyes going wide and quizzical. Rosie laughed, not a gas laugh, not a muscle reflex, a full-throated, open-mouthed, both fists clenched laugh. The laugh of something that had registered something funny and responded to it the way humans respond to things that are funny. She laughed twice. Then she reached her hand toward Clement's nose. Nadia started crying before she understood that she was crying. Not at the laugh, at the weight of how much she had needed the laugh to happen, and at how she had not known how much she needed it, until it did, and at something underneath that, something she had been carrying for 6 weeks without fully acknowledging it. Clement looked up at her. He left Rosie and crossed the 2 feet between them and pressed his head against Nadia's knee. He stayed there, warm and still, while she cried. If you stay for stories about what animals sense before we do, you're in the right place. Subscribe so you don't miss the next one. Nadia called her doctor that afternoon. It was the first time she had called. She had been not calling for 6 weeks. She described what she had been feeling, not in clinical terms, because she was avoiding clinical terms, but in the language of a person who had been managing rather than telling. Her doctor asked her to come in. They discussed what was happening. They made a plan. What Nadia told her husband Elliot that evening, and what she had said in various ways since, is that she had been waiting for a reason to call, something that gave her permission, something that told her the conversation was necessary rather than an overreaction. Clement gave her a laugh when she was too depleted to generate one. And then he came to her, not to the baby, to her. He had been watching for 6 weeks. He had registered something in her chemistry, her cortisol signature, the specific shift in a depressed person's scent profile that dogs detect before families see it, before doctors ask, before the person themselves can name what is happening. The laugh was the signal. The head on the knee was the bridge. She crossed it. Dr. Amara Osei, the therapist Nadia began seeing the following month, is a specialist in perinatal mental health. She told Nadia something in their second session that has stayed. Cortisol, adrenaline, the specific compound shifts of postpartum depression. These have measurable olfactory signatures. Dogs have been documented responding to these shifts in their owners before any verbal or behavioral signal is produced. We don't fully know what they detect. We know they respond to it. Clement responded for 6 weeks. He stayed close. He positioned himself adjacent at the low moments. He was, in the way of dogs who have chosen a person, simply present in the geography of her days. Has your dog ever seemed to know you were struggling before you could say it out loud? Tell us in the comments. These stories deserve to be heard. Rosie is 7 months old now. She laughs at things that are genuinely funny to her. Clement's head tilt, still the best one, still the most reliable. She reaches for him. He lowers himself to her level with the same patient competence he brings to everything. Nadia is doing well. The plan that came from that afternoon's phone call has worked. The wait has a different quality now. Every guardian deserves to be recognized, even the ones who understood before you did that you needed to be taken care of, and found the one way they had available to say it. If stories like this matter to you, subscribe so you never miss the next one. Clement still sleeps near the chair by the window, the low chair where the laugh happened. He is not a dramatic dog. He does not perform his love. He simply stays in the geometry of the people he has decided to look after. He decided that a long time ago. He has not reconsidered. What has your dog done that reminded you it was okay to ask for help? The story next time begins quietly. A Tuesday, a routine morning, an ordinary week that wasn't.